Hello dear students, today I am going to start a new topic in General Pathology called Apoptosis. This topic is also very important for your exam purpose. Let's start with the topic Apoptosis. What is Apoptosis? Apoptosis is caspase dependent programmed cell death. In our previous video we studied about the necrosis and it was defined as pathological cell death. But the apoptosis is caspase dependent programmed cell death. It is an ATP dependent process. That means it requires ATP for its processing. So it is an active process. It is present in both physiological and pathological conditions. The physiological conditions are organogenesis or embryogenesis. Other examples of physiological apoptosis are endometrial shedding after menstruation or the clearance of neutrophil when the acute inflammation subsides. The pathological apoptosis are seen in two conditions, like first is the presence of Councilman bodies in hepatitis C virus induced hepatitis, and the other one is the colloid or civet or the cytoid bodies which are seen in lichen planus. What do we find under microscope in an apoptotic cell? So we see the cell becomes small, that is the cell shrinkage is seen, and cells become more eosinophilic, that is they become more pink color, and the nuclear chromatins condense. So the nuclear chromatin condensation is the hallmark event of the apoptosis. Now the pathway of apoptosis. What are the pathways of apoptosis? The first one is the initiation pathway and the second one is the execution pathway. Under initiation pathway, there are two pathways. The first one is the extrinsic pathway and the other one is the intrinsic pathway. The extrinsic pathway requires caspase 8 and 10 and the intrinsic pathway requires caspase 9. Likewise, the execution pathway, it requires caspases 3, 6 and 7, out of which caspase 3 is more important. Now we will see what is happening in the extrinsic pathway. So what is happening in the extrinsic pathway? This is the T cell and this is the apoptotic cell which is destined for apoptosis. Now the CD, there is a receptor called CD95. CD95 or FAS receptor that is present on the apoptotic cell, and likewise the CD95 or FAS ligand is present on the T cell. When CD95 ligand and CD95 or FAS receptor interact, there will be the trimerization of CD95. But only trimerization is not enough for the extrinsic pathway to proceed. What do we require after that? We required another molecule called FAD. FADD, what is that? That is FAS associated death domain. This FADD help in conversion of inactive procaspase 8 and 10 into active caspase 8 and 10. Now we will study about the intrinsic or the mitochondrial pathway. Whenever there is an stressor like UV light, growth factors, hormones or any nutritional deficiency are present, then in our body some molecules called the stress signals are activated. These are activated. What are these stress signals? These stress signals are molecules called BIM, BID, BAD, NOXA and PUMA. BIM, BID, BAD, NOXA and PUMA. These are the stress signals that are present in our body. Now, when the stress signals are activated, they will do two things. Either they will increase the pro-apoptotic factors or they will decrease the anti-apoptotic factors. Now, what are the pro-apoptotic factors? These are very important to know. These are P53, BAX and Bcl-xL molecules. And what are the anti-apoptotic factors? These are Bcl2, MCL1 and Bcl-xL. So the NEET process is going to be the apoptosis to be proceeded in the forward direction. Now these pro-apoptotic factors will act on mitochondria. Mitochondria plays a pivotal role in apoptosis. It is a very important cell organelle for apoptosis. This mitochondria will release two things. Number one is cytochrome-c and the other is SMAC or diblo. Cytochrome-c is very important for apoptosis. Always remember that. Now, this cytochrome-c will combine with APAF1 or the apoptosis activating factor 1 to form another molecule called Apoptosome. This Apoptosome will convert inactive pro-Caspase 9 into active molecule of Caspase 9. Now the next phase, the execution phase. We know that our Caspases 8, 9 and 10 have been activated. Now these Caspase 8, 9 and 10 will convert inactive pro-Caspase 3, 6 and 7 into active form of Caspase 3, 6 and 7. Caspase 3, 6 and 7. Now this active Caspase 3, 6 and 7 will activate three enzymes. These are phospholipase, protease and endonuclease. This endonuclease will cleave DNA at every 180 to 200 base pair segments, creating internucleosomal cleavage to form the apoptotic bodies. Now the apoptotic bodies have been formed. These apoptotic bodies will be eaten up by the macrophages to clear them. Now the question arises, how the macrophage will know that these are my apoptotic bodies and I have to kill these bodies? They will recognize the apoptotic bodies by the presence of a signal called the eat me signal. Eat me signal are present on the apoptotic bodies. Now what are the three eat me signals? The eat me signals present on the apoptotic bodies are C1q, thrombospondin and the flipping of phosphatidylserine. So the flipping of phosphatidylserine is important for this eat me signal for macrophages. This leads to the completion of our topic of apoptosis. Now there are some important quick points about the apoptosis you need to know. What are these? If there is a defect in the phosphatidylserine flipping, we talked about the phosphatidylserine flipping from inside to outside of the cell. If there is any defect, then this syndrome is called the Scott syndrome. This is called the Scott syndrome. In this syndrome, what happens? There is defect in apoptosis and also there is some defect in the platelet functions leading to bleeding. Now, what are the markers of apoptosis? The markers of apoptosis are of two types. The number one is the hallmark marker. What is the important marker of apoptosis? That is annexin 5. And if you are asked about the biomarker of apoptosis, then you will say CD95 or FAS. Now, what is tunnel stain? The tunnel stain is a stain which stains the cell and is found positive in apoptosis and is found negative in necrosis. Negative in necrosis. Now, what is DNA gel electrophoresis? If DNA gel electrophoresis is done on an apoptotic tissue and in a necrotic tissue, then two types of patterns can be seen. Number one is step ladder pattern. Number one is step ladder pattern. But you need to know that step ladder pattern is present in both apoptotic and the necrotic tissue. But step ladder pattern is found more commonly in apoptosis than in necrosis. Likewise, there is another pattern called the smear pattern. Smear pattern is also found both in apoptosis and necrosis, but is found more commonly in necrosis than in apoptosis. There is one question for you. You will write it in my comment box. If annexin 5 is the marker of apoptosis that we studied, what is annexin A1 marker for? Okay, you will write it in my comment box and I will answer there. Till then, take care of yourself and keep studying and keep smiling. Thank you.